And then to continue with your specialized testing, you would use the finger pad for the 2-point discrimination, and you would try to find the minimal distance in which the patient can identify the 2 touch to the 1, and a normal would be less than 5 millimeters on finger pads. And you can repeat this on other parts of the body, but they're going to be varied numbers. You would also do point localization. I would instruct my patient to close eyes, and then I'm going to touch her, and then she's going to identify where I touched her. And then we would do extinction, and this would be, I'm trying to stimulate simultaneous touch with the patient's eyes closed, and then I would touch and then ask the patient to identify where I touch them on their body, and it should be corresponding bilaterally. Moving on, we would do deep tendon reflexes with a reflex hammer. And for your bicep, you're going to place your thumb pretty much in the bend of the elbow, and with the hammer, with this reflex check, you would actually strike your finger, looking for the contraction of the bicep muscle. Next, we would do the tricep, and I would use the hammer striking above the elbow, or for the contraction of the bicep muscle and for the elbow to extend. Then we would do brachioradialis, where I'm going to strike the radius 1 to 2 inches above the wrist, looking for flexion and supination of the forearm. Moving to the lower extremities, you would strike with your hammer just below the patella, looking for the knee jerk, and that's your patella tendon you're checking. You would dorsiflex the foot, striking the Achilles tendon for the ankle jerk. Cutaneous stimulation reflexes would be abdominal. You would then have your patient lie down again or lean back, and you're going to, in a X pattern, you're going to stroke the abdominal cavity in 4 different areas, each moving towards the umbilicus, watching for muscle contraction. Plantar, you're going to take either a pen or an object, a hard object, and you're going to start at the heel and move upwards towards the ball of the foot, and you're going to curve and come around that ball of your foot. I think that's it. And that would be the end of our neurological exam.